Early one morning, 72-year-old Richard felt a slight pressure in the center of his chest. It wasn't exactly painful, just a heavy, tight sensation as he got out of bed. He brushed it off, thinking maybe he'd slept in the wrong position or had a bit of indigestion. But less than 2 hours later, he collapsed on the bathroom floor and never woke up again. Richard's story isn't rare. According to the American Heart Association, more than 50% of people over 60 have experienced chest pain at some point, but most dismiss it thinking it's nothing serious. The truth is, early signs of a heart attack don't always come with sharp, dramatic pain. Sometimes it's just a dull ache, vague discomfort, or a strange tightness that lingers. What makes a heart attack so dangerous isn't just how fast it can strike, but how well it can disguise itself. It can look like acid reflux, a pulled muscle, or even just mild fatigue. That's why, especially for seniors, every episode of chest pain, no matter how subtle, should be taken seriously. Don't wait for your heart to scream for help. Let this article guide you through the first signs of a heart attack before it's too late. In medicine, chest pain isn't a diagnosis, it's a symptom. But it's one of the most confusing and uncomfortable symptoms out there. Chest pain can come from a number of different organs: the heart, lungs, stomach muscles, even the nerves or psychological stress. The problem is all those organs sit close together in the chest, yet the pain they cause can feel very different. Some people feel a crushing pressure in the center of their chest that could be a sign of heart attack pain. Others feel a burning sensation like acid reflux, often tied to digestive issues. And for some, the pain only shows up when coughing or twisting the body, usually pointing to inflamed ribs or chest muscles. For older adults, telling the difference gets even trickier. As nerve sensitivity declines with age, heart attack symptoms can show up in subtle or totally untypical ways. Some may feel nothing more than fatigue, anxiety, or indigestion, when in reality, those could be the first signs of a heart attack silently building up. That's why the first rule to remember is this: never self-diagnose chest pain. Every pain, no matter how small, deserves to be taken seriously and checked out. Because when it comes to your heart, ignoring the warning signs might be the last mistake you ever make. When you're young, chest pain is hard to miss, you feel it clearly. But once you hit 60, that sharp pain often dulls. That's why so many older adults suffer heart attacks without even realizing it. As we age, the nerves responsible for transmitting pain signals begin to slow down. That means chest pain, even when serious, can feel like nothing more than mild discomfort or everyday fatigue. People with underlying conditions like diabetes or dementia are even less likely to recognize pain. All the while, the heart is quietly taking damage hour by hour. A major U.S. study found that up to 40% of people over 60 who experienced a heart attack never felt any chest pain at all. It's called a silent heart attack. Instead of pain, they might just feel dizzy, bloated, or unusually weak symptoms that don't scream heart problem but should. What makes it more dangerous is how easily heart attack symptoms in seniors can be mistaken for something else like nausea, insomnia, heartburn, or a dull ache in the shoulder. So if something feels off, don't shrug it off with a casual, "It's probably nothing." At this age, every ache, every change is worth listening to. Don't wait until your heart cries out for the last time before you finally pay attention. 1. Mid-sternal pain. Pain in the center of the chest. If you feel pressure or pain right in the center of your chest, like someone's sitting on it or squeezing it tight, don't take it lightly. This is the most common pain location in people with heart disease, especially those experiencing angina or a heart attack. This kind of pain often starts during physical effort, like climbing stairs, carrying something heavy, or after a large meal. It may radiate to the neck, shoulders, or upper abdomen. The sensation is more of a tightness or shortness of breath, not a sharp or burning pain. That said, mid-sternal pain isn't always heart-related. It can also be caused by acid reflux, GERD costochondritis, or esophageal spasms. These usually come with a burning sensation and tend to worsen after eating or when changing positions. Because so many organs sit just behind the sternum, it can be hard to pinpoint the exact cause. But if the pain lasts more than 5 to 10 minutes, especially if it happens while you're at rest, take it seriously and get it checked out immediately. 2. Pain radiating to the left arm or lower jaw. When chest pain spreads down the left arm or up to the lower jaw, most people don't immediately think heart problem. But in fact, this is one of the key pain patterns that cardiologists pay close attention to. This kind of pain is usually dull and lingering. It may feel like an ache fatigue or a tingling sensation rather than a sharp localized pain. Some people feel heaviness in their left shoulder or soreness in the jaw, often mistaking it for a toothache or joint pain. But in reality, it could be a sign of reduced blood flow to the heart or even a heart attack silently unfolding. While other conditions like pericarditis, nerve inflammation, or muscle strain can also cause pain in these areas, you should be especially cautious if the pain comes on, suddenly isn't triggered by movement, and shows up alongside fatigue or cold sweats. These types of radiating pains don't scream for attention, but that's exactly what makes them so dangerous. They're easy to dismiss, and that delay can be deadly. 3. Tingling or crawling pain on the left side of the chest. Some types of chest pain aren't sharp or intense, but show up as a tingling, burning, or crawling sensation, often on the left side. It doesn't feel like the classic heart attack pain, which is exactly why it's so easy to overlook. This discomfort tends to come and go. Sometimes it feels like a light prickling or jabbing pain. It may spread slightly to the shoulder armpit or one side of the chest. People often describe it as weird or unsettling rather than truly painful, and it may be accompanied by fatigue or a racing heartbeat. This can be a sign of coronary artery spasm, where the heart's blood vessels temporarily tighten without causing immediate damage. But it's also common in people dealing with anxiety, chronic stress, or intercostal nerve inflammation. If this tingling or buzzing sensation happens repeatedly, especially when you're at rest or after an emotional event, don't brush it off. Sometimes the quietest warning is the first sign your heart's in trouble. 4. Pain radiating to the back. Some people don't feel pain in their chest at all, but instead experience discomfort in their back, especially between the shoulder blades or in the upper back. Sometimes it feels like the pain is shooting straight through the chest to the back. This is a serious form of chest pain that often goes unrecognized. The pain is usually described as sharp stabbing, like being pierced by a knife. It comes on suddenly and doesn't change when you shift positions. If it's accompanied by dizziness, cold sweats, or unstable blood pressure, you need to call 911 immediately. This could be a sign of an aortic dissection, a life-threatening condition where the inner layer of the body's largest blood vessel tears. If not treated promptly, it can lead to death within minutes. Of course, back pain can also be caused by other issues like pleuritis, thoracic spine degeneration, or strained muscles in the upper back or shoulders. But when the pain hits, suddenly is severe, or seems to move from the chest to the back, don't ignore it. It could be a sign of a cardiovascular emergency that requires urgent care. 5. Pain below the chest. Worse with deep breathing or movement. If you feel pain beneath your chest, especially along the sides, and it worsens when you take a deep breath, cough, or twist your body, it's likely not heart-related. This type of pain is usually sharp and easy to pinpoint. Pressing on the area may make it hurt more. It's different from heart attack pain, which is typically dull spread out and unaffected by movement or position. This kind of pain is commonly seen in conditions like pleuritis, costochondritis, or chest muscle strain. If the pain is on the right side, radiates to the back, and comes with nausea, it could be related to gallbladder issues such as gallstones or inflammation. Less commonly, older adults may experience similar pain from a hiatal hernia or acid reflux GERD, especially if the pain worsens when lying down or after meals. While this pain may not be as dangerous as a heart attack, persistent discomfort below the chest, especially when it affects your breathing, should still be taken seriously. If you feel more pain when breathing deeply, get it checked out to rule out any issues with your lungs or the lining around them. Not all chest pain means you're having a heart attack. And just because you're not feeling chest pain doesn't mean your heart is fine. So how can you tell the difference? A heart attack typically comes on suddenly. The pain feels heavy like pressure or squeezing and usually lasts more than 5 minutes. It doesn't change when you move or shift positions, and it may spread to the arm jaw or back. People often experience fatigue, shortness of breath, and cold sweats along with it. On the other hand, if the pain is sharp and in one specific spot, especially if it gets worse when you press on it or take a deep breath, it's more likely related to muscles, bones, or joints, not the heart. Burning pain after eating with heartburn usually points to acid reflux GERD. If the pain comes in waves, happens during moments of anxiety, and you feel your heart racing but there's no chest pressure, what you're feeling might be a panic attack, not a true heart attack. The best approach: don't self-diagnose. If you're experiencing unusual chest pain, especially if you're over 60, treat it as serious until a doctor tells you otherwise. Not everyone knows when chest pain is truly dangerous. But if you experience any of the following signs, don't wait. Call 911 or go to the hospital immediately. First, if the chest pain lasts more than 5 to 10 minutes, doesn't ease with rest, or keeps getting worse, especially if it feels like pressure or tightness, and radiates to your arm, shoulder, back, or jaw, it could be a heart attack. Second, if the pain is accompanied by cold sweats, nausea, shortness of breath, a racing or unusually slow heartbeat, dizziness, or feeling like you're about to pass out, that's a medical emergency. Third, if you have a history of heart disease, high blood pressure, diabetes, or high cholesterol, don't try to tough it out or guess what's going on. Every minute you wait could cause more damage to your heart. If you have aspirin at home and no allergies to it, you can chew 181 mg aspirin while waiting for emergency care. This is recommended by the American Heart Association to help reduce heart damage during a suspected heart attack. Prevention is always better than treatment, and when it comes to your heart, that's especially true. Many heart attacks can be avoided early on if you take care of your health and know the warning signs. First and foremost, keep your blood pressure, cholesterol, and blood sugar under control. These are the 3 biggest risk factors that can damage your heart and blood vessels. If your doctor has prescribed medication, take it exactly as directed. Don't skip doses or stop on your own. Second, build a heart-healthy lifestyle. Cut back on salt, sugar, and animal fats. Eat more leafy greens, fatty fish, and whole grains. Gentle daily exercise like walking, deep breathing, or senior-friendly yoga can do wonders for your circulation. Third, don't skip your regular checkups. A simple EKG, echocardiogram, or blood test. Every 6-12 months can catch warning signs long before your first episode of chest pain. Your heart doesn't need anything grand, it just needs you to listen early before it's too late. Chest pain isn't just pain. Sometimes it's your heart's final cry for help. And especially after age 60, being dismissive or waiting too long could cost you your life. Remember, every type of chest pain tells a different story from your stomach, your lungs, or your heart's blood supply. Don't ignore changes in your body. The earlier you act, the better your chances of survival. If you found this helpful, please share it with a friend, a loved one, or anyone who might be at risk for a heart attack. And if you've never had your heart checked, start today.